Well, hello, everybody. Thank you for being on this Zoom today. I appreciate you taking the time and listening to me talking about my thesis that I did for my doctorate degree. Yeah, I'm going to be basically talking about the presenting the research that I've done, and it's titled New Graduate Nurses Transfusion Training Views, Reflection on Experiences with Adverse Reactions. So to start with, please allow me to share some background on the research that led to the development of this, of the problem statement for my study. So as we know, the basis for competence are knowledge and skill. Nurses build on these two to deliver optimal and safe patient care. So depending on the diagnosis or the clinical status, blood transfusions can be a part of this treatment plan. And since blood transfusions are associated with high risks of triggering adverse reactions, nurses' knowledge in recognizing the signs and symptoms and stopping the transfusion is empirical in these situations. So through my review of the literature, I have seen that there have many studies were conducted to show that nurses don't have adequate knowledge about blood transfusions. They are not familiar with the correct process of blood administration, and there is a lack of sufficient recognition of transfusion reactions. Focusing more in the literature on new graduate nurses, I found out that there has been no research whatsoever conducted to explore the adequacy of new graduate nurses, evaluating their knowledge about transfusions, their training, and their emotional responses related to their experience with adverse reactions. So that took me to developing the purpose of this research, which was, if you think about it, in my mind, I wanted to take this literature that I reviewed and the findings that were there and further explore the adequacy of new graduate nurses and their training specific to blood transfusions and their emotional response to them watching and seeing their patient experiencing transfusion reactions. So the purpose of my study was that through description of the situations and the own experience of these new graduate nurses, I want them to reflect on their experiences of blood transfusion adverse reactions, acknowledge their emotional effects that they experienced at that time, and to reveal how that the training program and the schooling, the education that they got in schooling affected their response as well. So why is this study significant, especially for new graduate nurses? Well, researchers have discussed that how education and training enhance nurses' theoretical knowledge and practical skills. It improves their performance, augments their confidence, and allow them to enjoy the transition from being students to being professionals at the bedside. It also expanded on the emotional exhaustion, anxiety, and distress that these new graduate nurses experience in relation to the lack of confidence, being new in their clinical capabilities and critical thinking process that resulted in some medical errors, showed inferiority complex, and also the unsupportive practice in the environment as new nurses in the workforce. So, however, I found no research that specifically was associated, that associated all these factors to blood transfusions and adverse reactions. So the study basically addressed a gap in understanding the psychological responses that the new graduate nurses experience observing their patients having transfusion reactions, and also in evaluating the effectiveness of education and training on their confidence administering blood products and caring for their patients. The theoretical framework that I used was the social cognitive theory. So basically, theories focus on how learning involves perceiving and getting information, and it is based on what is already known and restructuring the information in something new to give a new understanding of the phenomenon. Because choosing the right theory brings useful viewpoints to the research and the focused issue, I consider this theory, the social cognitive theory, as the theoretical framework. The theory's main concept is the two-way interaction, first between the person and the environment, involving the beliefs and cognitive competencies. Second, between the environment and the behavior relating to the influence of the environmental factors. And third, between the behavior and the person influencing thoughts and actions. So it is an interaction between these three: the person, the environment, and the behavior. So I found that this theory summarizes what I wanted to kind of explore in these new graduate nurses. And using this framework aided me in understanding the new graduate nurses' perception of how training about transfusion molded their views and shaped their experiences at the bedside. Next slide, please. Many research have been done. As I mentioned earlier, through my literature review, there has been many studies that were conducted about nurses at the bedside. Some of them was related to transfusions, like studies about the transitions of new graduate nurses and how the results showed that it was difficult, it was challenging, it was stressful, and sometimes it caused traumatic events for these new graduate nurses. There are a lot of research about emphasizing the importance of education and training to enhance the theoretical knowledge, but that was not only the main thing. Practical practice and skills are equal in importance to improve and augment new graduate nurses at the bedside. Research shows that inadequate preparedness for new graduate nurses have been associated with emotional exhaustion, anxiety, distress, and related to, as I mentioned, lacking clinical capabilities and critical thinking. Implementation of structured training programs was enforced and recommended by many researchers to include classroom education, hands-on practical experience, because these two to put together while the new graduate nurses were still transitioning increases their competence, enhances their self-confidence, improves their job satisfaction, and decreases their intent to exit the profession. Because a lot of research shows that one of the main reasons why nurses are leaving the profession is related to what I just mentioned, especially mainly their confidence in doing the right things to their patients. Nurses' theoretical knowledge and applied skills also have been shown specifically for blood transfusion that it is critical because of all the risk factors that are associated with blood transfusions. It is important that nurses know the ins and outs of transfusions, blood administration, the process itself, verifying patients, identifying, blood types and compatibilities. And also, in addition to all this, they're supposed to be aware of recognizing the signs and symptoms that the patient can experience if a reaction happens, because at this point, the earliest recognition of these signs and symptoms can prevent, further more serious event and leads to nurses stopping the transfusion at early stage and the patient not receiving a lot of blood product. So as you see, there is so many relevant education, research has been done, but nothing really in specific focused on the nurse's emotional response when they see their patients having a transfusion. Next slide, please. So like with any research, there should be questions asked for these participants to kind of, explore the data or collect the data that we want. So research questions basically incorporate and mirror the purpose statement to define a knowledge gap while focusing on the phenomena itself or the concept that we're looking at. Thus, it's guiding the researcher to choose the method and sets the boundaries for the analysis that they're gonna implement in collecting data and analyzing that. So 3 research questions were asked for the participants. The first one, how do new graduate nurses describe their lived experience with the patients having transfusion reactions? The second question was, how do these experiences affect them emotionally and behaviorally? The third is, in what ways did these nurses, the new graduate nurses, training that they received influence their knowledge and their confidence in recognizing these signs and symptoms of that? For the research was a qualitative research using the hermeneutic phenomenological approach, which defined the terms of how the research is going to be done and made it easier to understand why did we choose this methodology. So just to give you a quick overview of what each of these words mean and how they are, how did they help shaping this research. So qualitative studies or qualitative research basically is used to explore experiences and to understand the problems and the situations and bring ideas from a personal perspective of the participants. So the opinions of these participants become very influential in shaping the findings of a study. The hermeneutic approach assists in understanding the participants' subjective experiences and their meanings as well. It helps us gain insight into their motivations, actions, and it also includes their narratives. So it's basically telling a story. So this process mirrors, if you can say that, it mirrors and it explains and puts to the readers the exact experiences in the exact words of the participants, which makes it more real and it feels like they are telling their story and their experience. Phenomenology basically aims at exposing the human side of the story and realizing the meaning and significance of these experiences by probing into the whatness, like what is it like for these participants. So it is just reflecting on their personal and subjective emotions and thoughts. Sampling for the study was purposeful for 12 new graduate nurses who met the inclusion criteria. So included in the study were new graduate nurses. We defined the period for considering them new graduate nurses between 1 and 3 years of graduation. So these new graduate nurses, to be included in the study, they have to have attended the new hire blood transfusion training program at their place of work. They have worked in clinical areas where blood transfusion has been given, and also that they have witnessed a patient experiencing a transfusion reaction. So you might ask, how would 12 new graduate nurses basically help or are sufficient to ensure the validity of the study? Well, in qualitative study, Data saturation and sample size have been a debate between many researchers. I chose Creswell's explanation for that, in that the sample size must allow for appropriate variation or diversity among participants and endorse reaching either saturation or redundancy of information. After reviewing interviewing 12 new graduate nurses, I found out that it is the same information, the same experience that they all have. So I felt that the information has been is trying to become redundant, and that's when I ended the sampling at 12 new graduate nurses. Data was collected using semi-structured conversational style and digitally recorded interviews. Unfortunately, when I was conducting my research, we started the pandemic and COVID hit. So I was not allowed to conduct face-to-face interviews with the organization that I was, with my place of work where I was conducting the research. So I had to basically change that to being a virtual via Zoom, and that impacted some of my data, delayed my research, and kind of gave me a turn to a different way of conducting data. The process of data analysis, I applied Colaizzi's strategy to explore the phenomena from the new graduate nurses' perspective, to see their subjective experience and draw from their description of these experiences with transfusion reactions. This strategy entailed exploring the nature of the phenomenon, giving meaning to their experience, and incorporating the storytelling to amplify their responses and capture all their social representation. The way I did that is by portraying the participants' living experiences through first, because it was virtual interviews and it was recorded. So I had to transcribe basically all the interviews. And that was a lengthy process, very detailed process that I went back and listened to each interview several times to make sure that I did not miss anything, and I did not document any of that. Second, I extracted statements from the interviews by identifying like phrases and sentences that directly related to what they told me about their experience. From these statements, I formulated a significant meaning by labeling each extracted meaning to the content and relevancy. Completing that, I went to categorizing each labeled meaning into a core concept that reflected what they described their experience as. At the end, I had to validate the data that I collected. So I emailed the participants with my review, my analysis, for their review, for their feedback, for their approval, and if they want anything to add or omit or change their what they told me. Next slide, please. Findings were basically three main categories where I separated the findings. So the first one was emotional distress and burnout. Participants shared vivid descriptions of the incidents. They shared their emotions. They described their situations with patient getting rash and itching, having rigors, becoming unresponsive. They even had to be, on ventilators, and all these kind of serious issues. Describing these situations to them was words like, it was a scary experience, it was traumatizing to us. It reflected how they felt stressed, nervous, anxious, and several of them expressed self-blame and shame that they were not able to take care of their patients as they're supposed to. So they experienced stress through feelings of nervousness, insecurity. They had low self-confidence. They felt inadequacy managing critical situations that required, problem solving and decision making. They self-doubted their competence and their ability to practice effectively. The second finding was the second victim phenomenon. So for the participants, observing their patients having a transfusion reactions was morally challenging. They suffered emotional exhaustion. They endured psychological distress. Many of them took their feelings home, and they started having nightmares. They felt that they don't want to go back to work, and they felt that they are failing the purpose of why they became nurses. These symptoms associated with moral distress were identified in research as a reason why new graduate nurses make clinical and medical mistakes, and they use the term second victim. So studies have shown that nurses felt as being second victims was related to their experiencing of shock, disbelief and helplessness, moral distress, shame, self-blame, and uncertainty of care of patients. The third finding was unpreparedness and reality shock. So participants voiced frustration with insufficient level of academic education and inadequacy being prepared to practice at the bedside. So for them, during training at their new facility, during their orientation process, they described the orientation as being more of listening to presentations, reading manuals and policies, and also, completing online modules and mandatory training. So it wasn't more of a hands-on. For these competencies that they completed, for the check at the end of their training, most of the knowledge was verified verbally and not by demonstration. So even sometimes that the competency they're checking was requiring demonstration to be validated. Most of them, they were just verbally voicing that. So for blood transfusion, for example, they were just telling that, okay, we start this, we verify this, we do that, but not actually having a hands-on. Many of them also related these issues to different sections. So for the school, for example, many voiced that they did not learn enough about transfusion and they were not, knowledgeable about the learning about transfusion reactions and signs and the symptoms that the patients may experience. So they described all the knowledge that they learned about transfusion was just textbook. So they only learned it as the book described it. Whereas for the clinicals, they voiced dissatisfaction with the level of the preparation, especially that they were not allowed to have hands-on practicing with blood transfusion. So it was either just stating that or watching it over a video or a presentation, how to administer blood and how the process entailed. When they got to the hospital, they also, about their training, they said that there was no hands-on. So the preceptors were not comfortable to allow them to start a transfusion and do this under their name, because they were still in training and they were responsible for them. They said that it was risky, and managing everything else with the patient and paying attention to the orientee, giving blood transfusion was too much. So they were only allowed to watch. And the only time they had hands-on giving blood product was really when they are out of orientation and they were on their own. So imagine the stress and the anxiety that they experienced just doing that on their own by themselves. Regarding the competency, they said that it is only check boxes, and really it wasn't hands-on and demonstrating, even for the skills that required demonstration. Next slide, please. So to explain and to do an interpretation for these findings and to relate the findings to the theoretical framework, we really can state that unpreparedness and incompetence of the new graduate nurses led them to experiencing negative psychological and physiological impacts. So they felt nervousness, lack of sleep, stress, and anxiety, which also influenced their workplace practices. So they were the way they managed the critical situations, practicing effectively. And all this leading to actions such as they're deciding to study limitations. In the study, I tried to be transparent by listing all the potential constraints, explaining implications, providing alternative approaches, and describing some modifications that I did to the steps, just to kind of eliminate the bias and avoiding actually the buy-ins that can threaten the reliability of the study. So I structured and phrased the interview questions in a way to avoid provoking extreme emotional responses for the nurses, to produce unbiased responses, and to try to trigger a reflex of their thoughts. While conducting the interviews, I took into consideration their demographics and common characteristics, centered my attention at the who am I interviewing more than what I'm asking them. So I had to acknowledge their emotions, and seriously, I had participants who had recently had a transfusion reaction experience that they were tearing up and, like their voice shaking and going through that emotional stress while they were telling me their experience. I pursued eliminating any buy-ins that can be influenced by me as the researcher, by preserving my professional demeanor, addressing details of the study design, maintaining integrity of the interview, and remaining neutral to the study motives. This topic is very close and dear to me. I work as a transfusion safety officer. I was a blood banker before I went into nursing. I've experienced so many transfusion reactions with my patients. So it is a topic that is dear to my heart. So I tried as much as I can to be objective and not let my emotions and, anything bias the research by itself. So to increase the trustworthiness of the study, I started comparing participants' viewpoints, established consistency of the data, as well as I emailed interviews when I transcribed them and I finalized them to the participants to kind of review them. I disclosed comprehensive information and vivid descriptions that they told me. I put their own words in the research to kind of convey the reality and the truthfulness of what they were telling me. I used integrated a process for auditing the data to examine the merits of how I gathered and analyzed them, and being very objective in projecting these. Recommendations that resulted from the research was that several of them. So the first one was adopting simulation for blood transfusion education and adverse reaction management is very important. I also suggested studies to be conducted to kind of follow and look at the proficiency of implementing such programs and what the results are if they improved anything. And then I recommended implementing educational programs that basically eliminate the gap in transfusions between the theoretical part that they learn in nursing school to the clinical practice during their clinicals before graduation to have hands-on practice, and also the proper job on-job training. Also conducting research after that to evaluate the outcomes of such programs was recommended as well. Social change. So this study is original in its contribution to literature through reflecting on the new graduate nurses' experience with transfusion adverse reaction, exploring their emotional response, and relating these experiences to their education and training. Utilizing the social change model aimed at making change that affects the society through a collaborative, service-oriented, and values-based process. The study findings may bring about social change to nursing programs and clinical practices, thus influencing the new graduate nurses' views of competence, self-confidence, and reflecting on their beliefs and attitudes and perception of their call to why they became nurses. The paradigm of this social change is how the collaboration of and the focus on the common purpose of the group, which are nurses, how it influences the congruence and commitment of individual, which are nurses as well, and how it's going to reflect on the public spirit of the community, which basically is the patients and families. So to me, this study pulls attention to all inadequate transfusion-related practices and education that needs to be changed, and specifically sheds light on the emotional distress that new graduate nurses go through. Next slide. I think that should be it.
Wonderful. That's amazing. And I am so happy to hear that you have been able to complete this, even though COVID interrupted your process quite a bit, didn't it?
Yes, it delayed me almost a year and a half.
I'm so sorry. Can you tell us something that you learned during this process that surprised you or that was unexpected besides COVID?
Honestly, as I said, this topic is really dear to my heart. You know, I'm a preceptor at my work. I've precepted many new graduate nurses. I know what are the deficiencies in the system, whether it is because I also was an instructor in a nursing school. So I've seen it all. I've seen it how it is in schools.
And how it was really bad even before COVID, right?
Yeah, definitely. It was before
because they've
COVID.
only figured out in the last 10 years that if you take better care of the nurses, you have better outcomes for the patients. So I'm so glad to see your research.
Yeah, well, definitely COVID, even besides what new graduate nurses were going through originally, COVID added 10 times to that. You know, the whole work environment at the bedside, you know, the stress even of the experienced nurses that they were taking care of these sick patients with the shortage in supplies, you know, learning every day new procedures, how to handle these patients, how to care to them. On top of all this, they were handling new graduate nurses and training them. So it was really bad for both of them. And the effect of all this put together on the new graduate nurses that were going through the pandemic and training and orientation was really bad.
Yeah. Do you have any bit of advice for students that are following behind you in this process and maybe trying to take your research a little bit further? Or how to conduct even the 12 interviews that you were able to get there to begin with? Because I know recruitment has been a problem for a lot of people too.
Yeah, it was. So I had to switch basically from doing in-person interviews in the hospital to posting it online and recruiting, you know, new graduate nurses from all over.
Yeah.
I tell them that even this is not an easy process. going through a doctorate degree or a master's and preparing a research, especially if it's a research that hasn't been done genuine. It was a challenge to finding a topic to do the research on, but put your heart to what you like. Don't just pick a topic just to finish your research, because it has to have a meaning to you. And what are you aiming at? What is the purpose? And no matter how many difficulties come across you, which there are going to be many obstacles, many ups and downs, so many times I cried my eyes out. I felt like, okay, I don't want to do this anymore. Put your head into it, and no matter how many obstacles come across, keep telling yourself you want to get there. Find a support system, whether it is your family, whether it is your professors at school, whether your colleagues at work. Find a support system, because they can pull you out of this darkness when you are in it, and that helps a lot.
Well, you
And
are
the last
a wonderful person to do that.
Yeah, and the last thing is just that keep pursuing what you want, no matter what, put a goal, put an end line and that you want to reach, and keep going towards it. Because the end, when you get there, I tell you, the minute I did my final presentation and my research went through, it was like, I'm in heaven. It's just like all the hard work, you just put it behind you. And it's just that rewarding feeling is amazing.
All right. Well, thank you so much for sharing this with us.